Get at it. Okay. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We've got high opinions of ourselves, don't we, Brad?
Oh.
Today, we're going to talk about the 3 rules for treating hip arthritis and pain. These are our rules, so you need to follow them.
There you go.
We like that when we're in charge. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. That's kind of 3 rules there, too. And you're going to want to go over to the Facebook and like us, Bob and Brad, because once again, we are giving away the Thermatex Far Infrared Heating Pad, Platinum Pad. Beautiful pad. This thing, the reason why it's so much better than regular heat, it goes so much deeper. 2.36 inches, right, Brad?
There you go.
Versus superficial heat.
You better believe it. And it's good, big enough to cover the back. You can wrap your knee, the hip. It's a very universal device. We love it.
Yep. All right, so let's talk about the 3 rules for treating hip pain, arthritis. The first thing you want to do, as much as possible, is you want to decrease the weight bearing on that hip. And I'm not saying that you need to do this forever.
Right.
But hip pain and arthritis tends to flare up and it tends to calm down.
Mm-hmm.
So we want to get it to calm down. So what you want to do is maybe for a while use a cane. Brad, you got this little psychedelic one there?
Oh, that is nice. As a matter of fact, I just worked with someone Tuesday, this problem. I had to work with her on gait, and her walking was like this.
Yeah.
She took the cane, and her walking became normal. Things calmed right down.
I'm glad you brought that up, Brad, because so often people say, I'm not going to use a cane. And, you know, I got my pride. I'm not going to use a cane. But they'll walk like this. Like you said, they're walking like this. Wouldn't it look better to walk with the cane? You don't think they're drawing attention to yourself by, you know?
Yeah, the canes really.
I mean, I understand it. Believe me, I understand it. I'm not trying to be unsympathetic.
I always tell them, you know, you look more dignified with the cane.
That's right.
Some
a walking stick.
Yeah, some people buy it.
And if you want to have something that maybe looks like you're maybe more of an athlete that got hurt, just use a crutch like this. My wife finally succumbed to this when she had hurt her knee.
Sure.
I mean, and she was like, I can't use a cane. But she used the crutch, and it worked out good. We actually had to put extra padding on there because you really start to rub in here, and it really breaks down the skin.
Sure.
So after a while.
And if you don't know how to use the cane or crutch properly, just Google Bob and Brad crutch use, cane use. We have some good videos on how to take care of that problem.
Right. And in addition to like using a cane or a crutch, you're going to want to avoid stairs and hills for that time period while you're trying to get things calmed down, because every time you go up on a surface like that, increases the stress on your hip.
Right. You know, if you do need to go upstairs, simply go up with your stronger, the less painful leg, and let the take one step at a time. That'll significantly decrease.
Up with the good, down with the bad.
There you go.
That's the old rule. Okay. Next thing you're going to do, you're really going to want to make sure you're stretching that hip. If generally, quite often, I had a patient yesterday like this, Brad. He's got very poor internal rotation. So on the one side, he went like this.
Yep.
And on the other side, that was it. He had no motion.
Yep.
And he was getting pain in his groin. And if I turned it that way, he went, ow, ow, ow.
Sure.
So we need to regain that motion. So you want to regain basically 4 different motions. You want to show them laying down, Brad?
Sure.
Why don't you do that?
So yeah, when you're working, the hip is one of those things that's got 4 ranges, and if you're not a therapist, and actually when I was learning this, it was a little confusing, but you know, once you get your head around it, it's fine. But hip flexion, should we go through that
Sure,
first?
let's go with hip flexion.
Okay, so hip flexion means you're going to take your knee and bring it to your chest. So that's bending the hip or flexing it this way. And you might find out this knee is normal, or this hip, I'm sorry.
That hip, yeah.
And this one, oh, it gets tight in here. So we want to eventually see if we can get it stretched up to here without flaring it up. So this may take a few days or a couple weeks. So we're going to work at it every day.
And if you have to use a belt or a sheet, go ahead and do that. We're just going to reach right in here, Brad. There you go.
There you go. So we just rolled up a towel, put some tape around it, and you know, you can go like this. And this just makes it easier for some people who may not have the range of motion, or you know, their body isn't just quite shaped right, so they can do this easily. So that works. You can go like this around the knee and stretch it. Again, you're going to stretch and hold and relax. Do that 5 to 10 repetitions. Should be enough for one session.
Why don't you go to external rotation, Brad?
Okay. This one, you can take, I always say, take your ankle and put it above the kneecap on the opposite leg and let the leg go down like this. This is one way to do it.
Yep, it's a figure 4. You can actually do it in a chair too. I'll bring the chair in.
There you go.
It's a really easy one to do throughout the day. You can just put your knee across your knees and you can go ahead and give it a stretch like this.
Right.
And you'll find one that might be up like this and the other one's down like this.
Right.
So you want to make sure you're stretching this one to get it equal to the other one.
Don't get too aggressive on the strips, on the stretches. You know, there should be no sharp pain whatsoever. If you've happened to had a hip replacement or a procedure done to your hip,
Yeah, you're not doing any of these.
You're not doing any of these. Just
Right.
turn this tape off and go find something else to watch.
Go have a beer on us. All right, what are we doing next, Brad? How about internal rotation?
Oh, this is the one that, you know, you just taught me this one because this was was hard to do. But both knees up like this. Now I'm going to stretch my right leg, the one closest to the camera. I'm going to take this over my left ankle over the top of the right knee, and I'm going to pull it away from the camera. And this really does a nice job on this part of the hip. And, you know, you can adjust here. You can move your foot to get whatever feels like a good stretch. When you got a good stretch, it's going to feel like, boy, that's doing a good job. You may, if you have some mild pain, but it feels like, oh, it feels like it hurts so good, or when you get done, it really feels good, that's gold.
Yeah, you can bump up against the pain, but don't go into the pain.
Right.
You can do this sitting down too. You can cross your leg over and pull it like this. And so I'm giving a little bit of stretch like that. You could even go like this, just work it this way. But internal rotation quite often is affected with arthritis. It's usually one of the first ones to go. So it's a great stretch to do.
There you go.
You want to show the combination flexion and extension, Brad?
Right. So, you know, this is probably for people who are a little more mobile and able.
Yeah,
you know.
don't fall off the bed. Please don't fall off the bed. Please don't fall off the bed.
Right. So as far as extension, if you go to the edge of the bed, so you're still stable and on the bed, let the right, in this case, the right leg, just relax and go over and let gravity stretch that hip flexor, that muscle. It's deep right here where your pocket is. Now, what Bob was talking about doing 2 at once, we can grab this knee and pull this. So we're extending the right hip and flexing the left hip.
You can actually bring your upper body over more, can't you, Brad, this way?
Over this way?
Yeah,
sure.
like that. So you're a lot more safer. There we go.
Yep, good point, Bob. Again, you know, you need to feel comfortable. This is for someone who is more mobile, but they got tight hips. You know, if you're 75 years old and have a hard time walking, you know, in that stage of your life, that
might be a difficult one to do.
Right.
You can do stretch the hip flexors also by kneeling down. A lot of times I put a pillow underneath this knee. I got a pad right now, so I don't need to. But as you can see, I'm leaning forward and I'm stretching this one right here. Or if I were to reverse, I can do this. And you can see now I'm stretching this one right here. Put a pillow down because it's hard on the knee.
Sure, you bet.
And I'm going to lean forward. And you were saying I have good posture, right, Brad?
Yeah, I was before my mic turned off.
Yeah.
Anyways, yeah, so he's got good tall posture. He has something over here. He's holding on to the plinth or a table, whatever there may be. You know, be relaxed while you stretch. If you don't feel relaxed, make sure you breathe relaxed, nice deep breathing. All those little things make a big difference.
So all that was rule number 2. Rule number 3 is you want to strengthen the hip a little bit. Brad, do you want to just show kind of a quick scenario of some hip strengthening you can do?
That's exactly what happened. I'm still on? Okay. Just some simple bridging. So your feet here, if you do this in bed, you know, hopefully your feet aren't slipping out. If you have your shoes on, it helps a lot. But a simple bridge, it's going to work the back part of the hip, the extensors, the glute maximus.
You're going to get some hamstrings with this too.
Yep. You know, and if you want to isolate her to get stronger, just put one leg out. Oh, and that gets quite a bit heavier.
That's a lot more difficult.
Yeah, we're going to do sets of 10. Does that sound like
a sounds good?
Now, and then I'm going to go this way so I don't lay on my mic. And a nice hip abductor. I was just working with a woman who had a hip replacement on this exact same exercise because she had the waddle in her gait.
Sure. I do lots of these.
Yeah. Yeah, and you know, you should feel that muscle in that hip starting. Mine's already starting to burn. Make sure your toe is not pointed up like this. There you go. And, you know, you can do the hip laying down like this.
And you can do some hip
there you go.
extensors too.
And make
so
sure
it's real simple. You can just, you know, go from their back to the side to you're prone, and you got them all covered.
You bet.
So, all right. Well, thanks, Brad, for doing all the work.
Well, yeah. Anytime, Bob. I'm always happy to lend a hand or a leg. or a hip.
Remember, we can fix just about anything
Except for
a broken
there
heart.
you go. But we're going to continue to work on it. We've been working on it for 7 years now, and we're not going to
You
stop.
think we'd be getting a little closer, don't you think?
Well, we got a little progress. At one time, we had that little heart thing,
Yeah.
and it was coming
didn't
together.
work.
It was,
Thanks for watching.